Welcome to 7 Healthy. Do you know what gastritis is and how it affects your health? If you're shaking your head, you're not alone. This medical term might sound a bit alien, but it's a condition many people grapple with. Gastritis, in simple terms, is an inflammation, irritation, or erosion of the lining of the stomach. Picture your stomach as a well-fortified castle, its lining acting as the protective wall. When gastritis strikes, this wall becomes compromised, leaving the castle vulnerable. It's important to note that gastritis can manifest in 2 forms, acute and chronic. Acute gastritis is like a sudden storm hitting unexpectedly and causing immediate discomfort. On the other hand, chronic gastritis is a slow burning fire gradually causing damage over an extended period of time. Understanding gastritis is the first step towards managing it effectively, and as with any journey, it's always better when you're not traveling alone, so let's delve deeper together into the world of gastritis. Ever wondered what causes gastritis? It could be more common than you think. Gastritis is a condition that inflames your stomach lining, and several factors can trigger it. One of the most common culprits is a type of bacteria known as Helicobacter pylori. This little troublemaker is also notorious for causing most stomach ulcers. It's a cheeky invader that can easily set up shop in your stomach, leading to inflammation and discomfort. Now let's talk about another prevalent cause, the regular use of certain pain relievers. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are often the bane of a healthy stomach lining. Overuse of these drugs can cause irritation and inflammation, setting the stage for gastritis. Alcohol intake is another common cause. Alcohol is a strong irritant that can erode your stomach lining, leaving it vulnerable to the harmful effects of gastric juices. This is a better glass of milk is better instead of alcohol consumption. Now, on to the less common causes. Autoimmune disorders, for instance, can lead to gastritis. In these cases, the body's immune system mistakenly attacks the cells in your stomach lining. Digestive disorders such as Crohn's disease and sarcoidosis can also contribute to the condition. And let's not forget about surgery complications. Operations involving the digestive tract can sometimes result in gastritis. Knowing the causes of gastritis helps in taking preventive measures, but how would you know if you have gastritis? Identifying gastritis can be tricky, but there are some telltale signs. Gastritis often plays a game of hide and seek in your body, making itself known through a variety of symptoms. Some are common, others less so. One of the most frequent symptoms is burning sensation in the epigastrium, heartburn, bloating, and a nagging feeling of nausea. It's like that pesky fly that won't leave you alone, persistently hovering around. Your body is trying to tell you something's not right, and it's important to listen. Then there's that peculiar feeling of fullness in your upper abdomen after eating. It's a constant, uncomfortable fullness, even after a small meal. The sensation can be accompanied by gastric pain, a gnawing or burning ache that can be felt from the navel up to the chest and radiate to the back of shoulder and neck. It can keep you awake at night or wake you from your sleep. Switching gears to the less common symptoms, unintentional weight loss could be a red flag. Your body may be having trouble absorbing nutrients, causing you to shed pounds without trying. Another uncommon but serious symptom is black, tarry stools. This could indicate bleeding in your stomach, which requires immediate medical attention. If you experience these symptoms, it's important to seek medical advice, but what can you expect when it comes to treating gastritis? The good news is gastritis is treatable. Let's talk about some of the options. When it comes to treating gastritis, the primary goal is to reduce the amount of acid in the stomach to alleviate symptoms and promote healing. One of the most common treatments is medication designed to block gastric acid production. Known as proton pump inhibitors, these drugs significantly reduce acid production, giving your stomach lining a chance to heal. Another type of medication used to treat gastritis works by neutralizing gastric acid. These are called antacids, and they can provide rapid relief from symptoms by balancing the acidity in your stomach. However, it's important to note that while antacids can alleviate symptoms, they don't treat the underlying cause of gastritis. In some instances, medication that protects the stomach lining may be prescribed. These drugs create a barrier that shields your stomach lining from acid, enabling it to heal more effectively. If your gastritis is caused by a bacterial infection such as Helicobacter pylori, antibiotics will be necessary to kill the bacteria. This treatment is often combined with medications to reduce stomach acid, providing a comprehensive approach to healing. But treating gastritis isn't just about medication. Lifestyle changes can play a crucial role in managing this condition. This may include avoiding certain foods and beverages that irritate your stomach, such as spicy foods, alcohol, and caffeine. Smoking can also exacerbate gastritis, so quitting is highly recommended. Regular exercise and stress management techniques can also support your overall digestive health. Finally, it's worth mentioning that everyone is different, and what works for one person may not work for another. It's crucial to work with your healthcare provider to find the best treatment plan for you. With the right approach, gastritis can be managed effectively. Remember, your health is in your hands. So there you have it, a comprehensive look at gastritis. We've journeyed through the intricacies of this condition, discussing its definition, causes, symptoms, and treatment options. Let's recap, shall we? Gastritis, as we've learned, is an inflammation or erosion of the stomach lining. It can be caused by a multitude of factors, from bacteria like H-pylori to certain medications, excessive alcohol consumption, and chronic stress, among others. Symptoms can range from heartburn, indigestion, and nausea to more severe manifestations like stomach bleeding, but the silver lining here is there are treatments available. From lifestyle changes such as dietary modifications and stress management techniques, to medications and in some cases even surgery. In essence, gastritis isn't just a single entity, but rather a complex condition with a multitude of facets. So it's essential to understand and recognize it for the sake of our health. Remember, knowledge is power. Stay informed, stay healthy, and remember to subscribe for more.